Hello, my name is Irene Irene Goyes, and this is module 5. Adult Health 1. We were asked to draw a diagram of an eyeball and to talk briefly about the structures of the eyeball, and then choose 3 uh, visual disturbances that are most common. And so let's get started. So here is my lovely drawing of the eyeball, and it's a little difficult to do on camera, so bear with me. But here, so we'll start here. So this biconvex shape here is the lens, and then in front of the lens we have the pupil, and then here is the anterior chamber, and the aqueous humor, which fills the anterior chamber, is here. And then we have the iris, and then down here we have the sclera, which is right here, and then the retina right here, which is this, represented by this gray circle around the eyeball here. And then we have the optic nerve here, and the vitreous humor, which is the liquid filled in this chamber here, which is the posterior chamber. So just to go over briefly about what the aqueous humor does, which is the fluid that's in the anterior chamber. It's clear, watery fluid filled with electrolytes, and it nourishes the non-vascular structures of the eye, such as the lens. Now, the lens, which was the biconvex structure that I showed, is behind the iris, and it changes the shape or alters the focal distance of the eye, refracts or bends light. The retina, which was the gray part around the eye here, all around, is the basically it converts images back of the eye, and it's made of neurons. And then you have the optic nerve, which basically transmits visual information from the retina to the brain. So pretty important there. The 3 diseases or visual disturbances that I chose for the eye are myopia, cataracts, and glaucoma. Myopia, also known as nearsightedness, is a refractory error, which is like, basically nearsightedness. They have farsightedness. Astigmatism can also be considered a refractory error. But we'll talk about myopia because that is one of the major visual diseases. And basically, the light that is used to be focused in front of the retina basically experiences refractive error. So this can usually happen in an abnormal long eye, and signs and symptoms can be blurry vision. And diagnostic test can be refractometry. And treatment usually can be corrected with either contact lenses or glasses. And the nursing management that I chose for myopia would be if the patient education on to number 1, always wear your glasses if they're using contact lenses, hand hygiene, eye hygiene, very important. Make sure they know how to properly use the contact lenses as well. Okay, so cataracts, signs and symptoms. The most reported signs and symptoms for cataracts is cloudy vision or looking through a fogged window. However, sensitivity to light can also be a sign and symptom. If not treated, it can lead to blindness. It's caused by aging or injury. And what happens when we age or when there's injury is that it changes the tissue to the lens. So the lens is affected in this disease. Diagnostic test that can be used for this disease is a visual acuity test, a retina exam, which is where they dilate your pupil, and an applanation tonometry, which is measures the fluid. Again, glasses can usually correct cataract. Again, myopia or cataracts are not per se cured, but the glasses do help with vision. However, glasses don't always work with cataract, so therefore cataract surgery would be needed. And what they do is they remove the cataract and they replace it with a like a plastic cataract to take place of that part. And a nursing intervention, especially if they're going to have surgery. A lot of patients may experience anxiety related to permanent vision loss. Sometimes this, with any surgery, there are risks that can occur, and permanent vision loss, unfortunately, is one of those risks. So lots of support for your patient and reassurance. However, a lot of attention to their possible anxiety that they might be having. Final disease I chose was glaucoma, and glaucoma is a eye condition, a bunch of eye conditions that damage the optic nerve. There are two types of glaucoma. We have open angle and acute angle. So the symptoms for open angle can be patchy blind spots, tunnel vision, acute angle, severe headaches, eye pain, nausea, vomiting, and blurred vision. And glaucoma occurs from elevated eye pressure in the aqueous humor. Remember, the aqueous humor was the fluid that is in the anterior chamber of the eye. Okay, and let me go ahead and just show you that area once again, right here. Okay, so treatment for that, which well, I'll get into more of the regular treatment, but I found, which I did not know was possible, they can do an eye shunt, which can remove the fluid from that area, which relieves the pressure. So in glaucoma, the main treatment or goal is to lower or decrease the intraocular pressure. Okay, but typically, shunts aren't utilized all the time. However, eye drops such as prostaglandins or latanoprost or a beta blocker, which is timolol, are some of the popular ones that I have seen, and oil medications and laser treatment. But I was mostly impressed with the surgery of the shunt. Never heard of that before. Lots of opportunity for patient education here. It is important for them to remember to instill those eye drops, especially if the patient is elderly. They need to have a caregiver or a family member administer these eye drops on a timely manner, or remind the patient to administer those eye drops. And all of these diseases are progressive, so can't be cured, but can be slowed down. And so that is my presentation. Thank you.